Good morning, everyone. Today we are going to deal with a significant topic, ethical issues in healthcare, a physiotherapy viewpoint. My name is Bibin Prasannan and I have done my bachelor's and master's from Manipal University. My specialty is orthopedics and hand rehabilitation. So this section we are going to deal only with the introduction part. In the following weeks we will be dealing regarding the legal aspects, regulations of international organizations, clinical practice, private practice, what are the ethical issues that you have to deal in academics and clinical research, administration and management, and other miscellaneous issues. What is ethics? Ethics is basically an unwritten moral code of law that binds the human behavior. The word ethics came from a Greek word called as ethikos. The Greek word ethikos means arising from custom, and the French word ethos, which means custom itself. Ethics is never simple to define. It basically responds or explains the way by which a human being responds to his situations. There are certain simple questions like, we are living in a distressed society, we are living when people around us are dying due to hunger. Is it just that we are living a life of luxury and we are eating good food? Is it ethical that all the human beings are dying hunger when a human being is sitting and eating at his home? So questions that poses ethical dilemmas are never easy to answer. The only solution is how a person discriminates or how a person arrives at a judgment, taking each ethical situation at a time and reading it as a case by case. The first incidences of ethics were well demarcated in the religious scripts, coming from Buddha, Taoist, Plato, Aristotle, all the great leaders or all the great prophets were basically involved in outlining the ethical guidelines. So it was earlier only devised concept and it's nothing new. Starting from Buddha, starting from Taoist, Plato, Aristotle. So we are maintaining that all of them maintained the norms of ethics, and it was later incorporated in all the holy textbooks. So just to show how tricky the ethical situations are, I'm just going to demonstrate a simple situation. I know that world has improved and the situation of racial abuse is very rare, but in case where it exists, it's still an issue. We know that a lot of Indian physiotherapists are working abroad, and what happens when a client abuses physiotherapist on basis of race? How the physiotherapist should respond? Four options are there. The physiotherapist should stop treatment immediately and tell the person to get out of his cabin. Second, the physiotherapist complains to his superior regarding the client. Third, physiotherapist abuses the client in the same manner. Fourth, physiotherapist tells the client that the remark is abusive and continue the treatment. Some person may argue that we should stop treatment, or some of you who have a really thin skin may tell you have to abuse the client in the same manner. But the moral code of ethics says that the client should be reminded that the remark that he has given is abusive and physiotherapist should treatment. So now we are coming to deal with the professional ethics. Professional ethics is actually more complex than social ethics. In social ethics, a man thinks only about the ideologies of society, but in case of professional ethics, a human being has to consider himself, his fellow professionals, and he has to think about his patients also. So comparing and contrasting all the two population, he has to arrive at a proper judgment. Then only the role of an individual or a professional in a professional ethics is fulfilled. So what is this professional ethics? Professional ethics basically has 5 important ethical dimensions. It shows clear-cut boundaries. It shows what is the boundary between a colleague and a colleague, what is the boundary between a patient and a therapist, where the therapist should interfere in the treatment, where he should stop interfering in a patient's social status. Second, there is commonly accepted norms of behavior, certain moral conduct behavior, certain dress codes. So there are certain norms of behavior which every physiotherapist are commonly expected to follow in a professional setup. Professional ethics says that a physiotherapy profession should try to gain respect from within and outside the profession. Always, the physiotherapy aims at protecting rights of the client, and at the same time, at last but not the least, the professional's rights should be protected in case he is falsely accused. Medical ethics. The first instances of medical ethics can be seen in religious scripts like Manusmriti, Confucius, Hippocrates. All the great leaders talked about medical ethics. The famous Hippocratic oath came from such a great thinker of the medieval age, Hippocrates. So ethical codes were already designed before. The modern medical thinkers, mainly Thomas Percival, Buchan, Childress, these 3 scientists were the pioneers who championed the 4 principles of medical ethics. So let's look into the 4 principles of medical ethics or bioethics. The first principle is autonomy. The client has the right to opt out of any treatment options available to him. So if you feel that a particular modality is best for the client and the client rejects it, the ethical principle of autonomy says that the client has an option to reject and you have to go to the next best treatment modality. From the physiotherapist side, there is always an option that he can advise the client why you have selected a particular modality for a condition, and if the patient is getting convinced, then it's okay. But if the patient is insisting that he doesn't want that particular modality, then it is best to leave to the choice of the client for your safety. The second principle is beneficence. Beneficence says that the client should get all the benefits of professional knowledge of a physiotherapist, which should help in overcoming his musculoskeletal, neurological or any cardiopulmonary dysfunction. The third principle is justice. Justice makes sure that the duty provider always ensures that justice is done to the patient who is under his care. And the final and most important principle is non-maleficence, which means to do no harm. Always, it's not easy to follow all the 4 ethical principles at a time. Always, the ethical principles conflict with each other. For example, if a patient is having pregnancy associated low back ache and she is referred to treat for low back ache, you are opting for moist heat and the patient prefers ultrasound. The theory of autonomy says that patient has complete right to go for ultrasound. But in that situation, would you go for ultrasound, or would you advise the patient that ultrasound can normally lead to the damage of fetal cells? So always I am saying that the ethical principles conflict with each other, and always follow a case-by-case basis rather than sticking on to the particular ethical principle. Do what is best at the present context that can benefit to your client or patient. Next, coming to ethical issues in physiotherapy practice. Ethics is a moral code of conduct that defines the relationship between therapist and his patient or client. Physiotherapy, a profession started on the medical professional, has later regained an independent status. And with increasing independence, the physiotherapist's judgment role increases. And with increasing judgment role, patients always expect a lot regarding their clinical management from therapists, and if anything goes wrong, physiotherapist is legally responsible for through all the other options. If you're going to tell the patient that walking will take through all the other options, through all the other options if you're going to tell the patient that walking will take many years, you are giving him a false hope that he is going to walk. You cannot walk in your lifetime. That's an ideal option actually, but it is too negative and it may damage the morale of a patient. The third option, a physiotherapist obviously tells the clients regarding the charge, but this option is little conflicting. It gives a notion that you are going to treat the patient only if he can pay you 250 rupees. So that's also not supposed to be ethical in the scenario. So we have dealt with ethical issues or ethical rules or laws followed by physiotherapists in a physiotherapy setup. But what is not well known is that patient is also bound by certain ethical rules. As we say, the rules are common both for the professional as well as his client. So what are the rules of ethics that are bound to the patient? One common example that I want to demonstrate is you have got a patient in your busy setup and he has come with acute muscle soreness, and you're giving him a hot fermentation. So you have warned the patient that the patient should not change the padding of the hot pack without his information, and you are occasionally checking the patient. But without your information, the patient has removed some of the paddings of the hot pack and he has fell asleep, and when you come back you can see a big blister on his back. So and the patient starts complaining that it's your fault that the blister has obviously happened, and he registers a complaint against you. Such case of a complaint is actually non-existent or irrelevant, because you had already warned the patient regarding the consequences if he is going to remove the hot pack, and the patient was not able to follow your command, or he was too enthusiastic enough to see what will happen if the paddings of the hot pack was removed. So such sort of a complaint arising in that situation is called as frivolous complaint. So frivolous complaint is a complaint that arises when cause of complaint is negligible or so irrelevant. So what is the problem with this frivolous complaint is that frivolous complaint always results in defensive practice. What is defensive practice? Defensive practice is the practice or a methodology that a therapist adopts in such a way that the technique that you are giving or applying the patient may not be beneficial to the patient. For example, you want to give glide to the patient, you want to increase the abduction range of the patient, you will be opting for inferior glide. So as the complaint has arisen before, so in your clinic you got a patient, as I told, you have applied hot pack and he has went for a complaint against you, so that thing is in back of your mind, and you are giving glides very slowly in such a way that rarely there is any inferior translation of the head of the humerus. So, frivolous complaint always results in defensive practice, and defensive practice always leads to decreased effectiveness of physiotherapy procedures and physiotherapy techniques. So, if frivolous complaint is not there, defensive practice can be avoided. But unfortunately, in many parts of the world, defensive practice is still followed. Next, we are coming towards the responsibilities of a physiotherapist towards the client. Most important, confidentiality. The main thing is always discuss the aspects of the patient which are important only to treatment. Whenever you are discussing the case condition with a colleague, never mention the name of a patient. This is something that we all miss out. We always try to tell, okay, spinal cord injury patient named this in this ward. All are unethical. You should discuss even with your colleague by keeping the data confidential if the patient opts for. And always opt for a confidential atmosphere. The patient's record should not be made in public, even in case of insurance issues, until and unless specified to be publicized. In many cases, you might be showing some example to one patient to another patient. For example, in case of a spinal cord injury patient having same level injuries, you would try to encourage the patient, showing the progress of another patient, telling his name and history, but always obtain the consent of patient or patient party before discussing condition of a patient with another patient. Coming to economics, unnecessary economic burden should be avoided. If a patient of poor socioeconomic status is advised to give SWD for multiple joint pain and the total treatment cost is around 500 to 550 rupees, if you are going to give SWD to around 6 to 12 joints, better opt for hot pack, which can give similar benefits, and you can advise the patient you can come back for physio once the pain has subsided. Dissipation of knowledge. Patient always has a right for information regarding his conditions or treatment options, but let me say that there are certain restrictions for it. A terminal blood cancer patient, sometimes physiotherapists may hide the fact, telling that medical access of records are not available to him. But in that scenario or in that situation, the full details should be made aware to a family member if specified. But the situation always demands that patient has right for information, but certain conditions always demands us to deviate from the usual norm. Second is the most important concept. Never feel bad if a patient is leaving you and going to another physio, because patient always has a right to change the healthcare. So let me conclude by telling that even though ethics is multidimensional, I want to quote a famous saying of the late Mr. Mahatma Gandhi. He was a person who told that the only tyrant I accept in this world is a still voice within. Ethic of an individual may be varying from that of a society or that of a profession, but always make clear that you follow the voice of truth and voice of what your heart says. So this is all in the introduction to ethics. Thank you for your time and listening.